Hi everyone! Today our group is going to talk to you about something that could literally save a life, which is how to perform CPR on an infant. While we hope to never have to use it, knowing how to respond in a life-threatening situation could make all of the difference. In this micro lecture, we are going to walk you through when CPR is needed, the exact steps to perform it correctly on a baby, and a few important tips to remember during an emergency. First, let's talk about what to do before starting CPR. Always check the scene to make sure that it's safe. You don't know what happened and you don't want to become a victim yourself. If a parent or guardian is present, ask for permission to help the infant. You don't want to perform CPR on an infant where the parent or guardian is denying consent. Then you're going to check the infant for responsiveness by gently tapping the foot and shouting. If there is no response, it is time to act and perform CPR. You need to also check for breathing no more than 10 seconds. If the baby is not breathing or only gasping, CPR should begin immediately. So here's what CPR looks like for an infant. The first step is you're going to lay the baby flat on their back on a firm surface. You don't want to do like a bed where there will be a lot of movement. You want to do the floor or a table or somewhere where there's not going to be much movement. You are going to use both of your thumbs side by side in the center of the chest, just below the nipple line. You can see the photo that is added on this slide. That is how your hands should be adjusted. The third step is you are going to give 30 gentle compressions at a depth of about 1.5 inches. You're going to do this at a rate of 100 to 120 beats per minute. A good way to remember how to do this is the song Staying Alive. That has a really good beat to do your compressions. The fourth step is you are going to give 2 rescue breaths. You're going to gently lift the head of the infant to a neutral position. You're going to cover the baby's mouth and nose with your mouth and blow for about 1 second, just enough to make the chest rise. You are going to continue this cycle of 30 compressions and 2 breaths until the baby shows signs of life. If an AED is ready to use, you will stop compressions and you will do that, or the only other reason that you may stop is for emergency help to take over.
If available, use an infant CPR mask. This specialized mask is designed to fit an infant's smaller face, helping to create a more effective seal when delivering rescue breaths. Using a mask also reduces the risk of disease transmission between the rescuer and the infant, which is especially important during emergencies. If an AED, automated external defibrillator, is available, ensure it is equipped with pediatric pads. These pads are designed to safely deliver a lower energy shock appropriate for infants and children. Follow the AED's voice prompts carefully. The device will guide you through the steps. If the AED advises a shock, make sure no one is touching the infant when the shock is delivered. Resume CPR immediately after the shock if the infant remains unresponsive and without a pulse. Lastly, having access to PPE, personal protective equipment, such as gloves, a face shield, or a CPR face mask is essential. PPE not only protects you from potential exposure to bodily fluids or infectious diseases, but it also ensures that the resuscitation effort is as hygienic and as safe as possible for both you and the infant. Here are a few tips to keep in mind when performing infant CPR. Avoid overventilating. Infants have very small and sensitive lungs. When giving rescue breaths, a gentle puff of air, just enough to see the chest rise, is sufficient. Too much air can damage the lungs or cause air to enter the stomach, which may lead to vomiting. Be very gentle with compressions. Use only 2 fingers to compress the chest, about 1.5 inches deep, and let the chest fully recoil between compressions. Applying too much force can easily cause rib fractures or internal injuries in infants. If you're alone and no one is available to help, begin CPR immediately and continue for about 2 minutes, approximately 5 cycles of 30 compressions and 2 breaths, before pausing to call 911. This ensures that the infant gets crucial early intervention even before emergency services are contacted. Stay calm. Even though it's a high-stress situation, maintaining a calm and focused demeanor can help you perform CPR more effectively. Confidence and composure can make a significant difference in the outcome. Lastly, keep track of the time. Knowing when you started CPR is vital information for emergency responders. It helps them assess how long the infant has been unresponsive and what additional actions may be needed.
In conclusion, when you are performing CPR on an infant, it is a high-stress situation, but with the right training and the right mindset, you can give that baby a fighting chance. You just need to remember the key steps. You need to remember to recognize the emergency, start the compressions, give gentle breaths, and keep going until help arrives. Every second counts. Your actions in this situation can save a life. Thank you for listening, and we hope this gives you the confidence to step in if you ever need to.